right, so now local. So this is the bread and butter. This is what I do a lot. I hardly, to be honest with you, do general. If I feel it, this is where I want to move it. I do centrals, unilaterals, and rotations. This is what I do. And I try to be as local as I can, specific. So let's say, Kathleen? Catherine. I was close. At least I didn't say Stephanie. Catherine the Great. All right, so let's say in my examination, I went through my process and found L5, or let's say L4-5 was her most symptomatic. So I felt like, okay, I want to do a local rotation at L4-5. And usually with the local, I'm gonna usually do more grades 3s and 4s. I mean, you can do 1s and 2s, but if it's a pain-dominant patient, they're not going to tolerate me twisting them and moving them. So I'm going more towards 3s and 4s. So in the past, we've said if you're going to do local, you're going to gear to more 3s and 4s. But know that you can do 1s and 2s with it also. So I'm going to palpate and see, want the patient nice and relaxed. So you're going to feel where 4-5 is. Okay. So that there. Now what I want to do, so you want to grab patient's ankle. You want to put their knees into your groin area. So this way, this is what we call a pivot on the lumbar spine. Passive physiological intervertebral movement. So I'm going to have her knees into my groin. So I'm going to get into a squatting position. Grab her ankle, but I'm not going to do this. This I'm going to start adding side bending. I don't want to do that. I want to keep her in neutral. Okay? So I'm going to move her with my body. So I'm going to take her into flexion and extension. Relax, you okay? Don't. So just going to go into, we want to try to figure out where is neutral, that midpoint, because that's the position I want to put her in, is a midpoint flexion extension position. Okay? So that's where I feel like her neutral is. I'm going to have her straighten out her bottom leg for me. Okay? I'm going to bring it up just to get it a little bit more stable, but I may have to adjust it here a little bit on her top leg and put it there. Okay? Just going to switch hands. Same thing, just as with the general rotations. So I just want you to relax for me, and now I'm going to, let me do all the work. Don't help me. So I'm going to take her into a bit of flexion and a bit of rotation and take her to the point where I start to feel her move right about there. And I'm going to drop her arm, or have her grab her arm here. Going to come underneath. Stay like that. Yep, yep, grab that. Yep. Okay. Now, what I want to do, she's a little far away from me, so I'm going to rotate her and bring her close to me. Okay? And I'm going to stabilize with my thumb at L4, because I want to do 4-5. And I'm going to use this arm on her pelvis. I'm going to rotate her pelvis. I'm going to bring my body close to her. Okay? So I'm going to use my ASIS almost on her ASIS. And I'm going to do a rotation, a local lumbar rotation. So I'm going to feel for kind of where R1 is, where R2 is, and I'm going to do a grade 3, localized rotation, using my body. You okay? Then, if I want to do a grade 4, R1, R2, now I'm doing a grade 4. Doing okay? And then if I wanted to do a grade 5, then I thrust quickly. Wasn't very good. No audible there. Okay? And that's it. That's all. That's it. Is when you local, that's it. You're using your body. And we'll get into that next week. So let's just practice the positioning, grade 3, 4 movement. Now in the past, some will do this, or you'll see it in the textbook. stabilizing 4 and then using your other hand to get on 5 and then trying to do a local rotation. But I've found that if I just stabilize 4, I use this better and using my body and rotating with my body, using my arm and using her pelvis. Okay? So grade 3 is large amplitude, grade 4 small amplitude. Okay? And then guys, come around here, come around, because what's important is I want you to see my positioning. So I have her situated, stabilized here and here. Go ahead and straighten out your bottom leg, Catherine. There we go. Okay. All right. So I want her pelvis to be at an angle, because this is going to help me mobilize a lot easier, and especially is going to help me with manipulating. Okay? And I want to get my hip, my ASIS on top of her, so I can control her. I can make sure she's nice and relaxed. She's feeling hopefully safe and comfortable. She's not going to fall off. She's feeling secure. It's just like anything when assessing the hip motion, I got my body on top of her. See my legs. My back leg is back. I'm on my toe, and I'm putting most of my weight on my front leg. Because then when I'm doing my mobs, when I do the manipulation, I can drop it and drop it. Because that's how you're going to manipulate. Rather than use your body, it's really a dropping. It's a lot easier. I used to do this, and it seemed a lot more work. This is a lot easier. And I want to get you guys used to that. Okay? But I want you to get used to this position, and then keeping your elbow tight on your body. And you're just doing a nice rotation.